Medication is another helpful strategy in dealing with osteoarthritis pain. Medication may reduce inflammation, help you stay active, treat depression and anxiety, and help you sleep.
Some people are really apprehensive about medication for the same reason they're apprehensive about using a cane. If I have a chronic health condition, I start taking medication, then I'll never stop. Well, just as you can have a flare-up of your disease, you can have periods of time where you need medication, periods of time where you don't.
Pain medication works better if you take it before the pain gets bad. If you wait until the pain is severe, the medication doesn't work as well, which can be very frustrating. Be sure to follow your physician's advice and read the labels on all medications. If you know you are going to do an activity that has made your arthritis pain flare up, take your pain medication on a regular basis before and after to prevent the pain from getting bad.
You need to take medications, early. You need to avoid flare-ups so that you can get out, and you need to listen to your body. You have to respect what your body's telling you.
And that's very important, to time your medication with an activity. If you want to have an afternoon of an increased activity, well, take something for it an hour before you do that.
It's always a good idea to talk to your doctor and/or your pharmacist about your pain medications and about how much and how often you're taking them.
Yeah, it is.
So that they can monitor you for side effects like high blood pressure or changes to kidney and liver function.
What pain medication can I be taking for my osteoarthritis?
Probably the best to start with is Tylenol. Over the counter, one could also add in or even use alternatively some Advil, which is also over the counter.
Okay.
That works a little differently than Tylenol. It has both anti-inflammatory and pain-killing properties. Some people find that one works better than the other, and often when used together work better than either individually. The prescription arthritis medications, by and large, tend to be relatives of Advil, and tend to have the same kind of side effect profiles, so they can bother the stomach. There are some medicines that can protect your stomach from the Advil, and in some individuals we have to be careful with the effects on the kidneys and the liver, and the effects on the kidneys in fact can lead to a bit of an increase in the blood pressure, in some cases a bit of fluid retention.
Okay. Now, as you know, I am taking medication for other conditions in my life. Would these conflict with my osteoarthritis medication?
It's really important for me as your physician to know what you're taking, and I include complementary medications with that as well, because there are potential interactions between many medications and arthritis medications. And we sometimes have to tweak the blood pressure medications a bit. And again, we have to be vigilant about potential effects on the kidney.
I've heard of people using pepper cream. Can you tell me what that's all about?
Sure, that's available over the counter. Capsaicin is the generic name. And it does have pepper, the active ingredient is something that we think interrupts the pain signal back to your brain. And some people, in fact, get quite good relief. And not everybody tolerates the cream. Some people find that they get a fair bit of burning with the cream, so that's something you won't know until you try it.
Right. What if the medication stops working?
No, if they're no longer managing your pain, there are some even stronger painkillers that we can use. Mm-hmm. And then, of course, it may be necessary to go to surgical alternatives.
Really? Should I be keeping track of all the medication I'm taking, like every pill?
It's very helpful for me to have a sense of whether your medication utilization is stable and at what level, whether it's increased a bit, whether it's decreased a bit. The more you know about the medications, about the side effects to look for, about the benefits, being in tune, what helps, what doesn't help with your own body, there's no question that you'll be more successful in using those medications to manage your arthritis and to optimize your activity.
Good.
Don't try